One of the most common questions that I get asked in private practice is about pain. How do I get rid of pain, whether it be in the neck or low back? This video, I'm going to give you a few good things to think about when it comes to helping to reduce or eliminate some of your pain levels in your body. And I'm Dr. Steve. Let's get connected. So when we look at the physical body, it's really easy to get caught up in just the physical realm in terms of looking for a diagnosis, looking to see what's wrong in the physical body. And so at the beginning, we need to reframe actually potentially how our body works and how it actually functions. The first is that your body is a system that's constantly looking to adapt to its environment, meaning that it actually doesn't screw up. It just responds to what's happening both in the environment, and it responds to thoughts and emotions and different feelings that we have inside of our system. So our system is in a constant state of adaptation. So keeping this in mind, that means that whatever's going on in life or whatever's going on in our thought process, our bodies are constantly trying to adapt to that. So if we feel really stressful and we're looking at life as a very stressful event, then our body has to respond to that. It has to tighten, it has to protect, it has to defend. If we're feeling really supported and we feel really good about life and we're feeling really energized and inspired, well, the body's going to say, well, there's no threat here. We don't need to tighten. We don't need to create we don't need to create symptoms necessarily to get their attention that something needs to change. In fact, they seem to be in a flow of life. And so when we're in a flow with life, our body works and it's more fluid and more flexible. So to start, just taking a look at seeing, where you're at in life and how you're perceiving life at this current moment. That's a really good place to start when you have some sort of physical pain, whether it be in your spine, your neck, your low back, or any other area of your body. Then we have to look at our body almost like the Russian dolls in layers. And there is a physical body, the spine or ligaments or muscle tissue. There's those things. And I find people getting really caught up in trying to diagnose whether it's a bulging disc or whether it's a muscle tear. And we tend to hyper-focus on something physically wrong with us. So I find that is part of the puzzle. But remember, like the Russian dolls, there's kind of stacks and layers to it. And so the physical body is one stack or one kind of, you could say, superficial or first Russian doll. Then there's a second layer, and the second layer is our emotional body. And our emotions are based on fear or love or courage or any set of emotions. And so we have an emotional body that's also wrapped up in this symptom. And then we have our mental body or our mental realm, which is also wrapped into our body, which is a set of stories or rules or ideas or identities that we have that's wrapped around in our physical body. And so we have these physical layers, then we have these emotional layers, and we also have these mental layers that wrap and encompass our system. So we need to be taking a look at all of these, because it doesn't matter what practitioner you go to, they're going to be looking through the lens of what they tend to focus on. So if they're a very physically oriented practitioner, then they're going to look in more of the physical realm. If there's someone that deals with more of your emotions and your mental self, then they're going to tend to look at the symptom through the eyes of those. So why don't we just be intelligent? Let's honor all three and look at the body in terms of that. So let's take low back pain, for example, which is extremely common. Over 80% of the population experience that in their lifetime. So let's take a look. So the pelvis, as an example, is associated with our sense of self, of who we are, and also our relationships. The lower neck, for example, which is another really common area to hold tension and have pain, is associated with where we would store guilts and angers and resentments and in that lower part of the neck. So we have these two areas of our body which are very, very common in terms of producing symptoms or pain. So how do we look at it from the physical level? Well, first of all, we have to, if you're looking at the lower back, you have to look at core strength, you have to look at abdominal strength, you have to look at how you're coordinated in terms of your movements, how often you sit. So you need to take a look at that. And in the upper neck, you look at your posture and how we hold old tension through the shoulders and through the neck. Do we type a lot on the computer? Have we been in car accidents? Things that impact you physically. So on the physical realm, we could look at this muscle tissue having a physical phenomenon from a result of physical causes. Then we look at the emotions. And when you have pain, immediately it elicits an emotional response. And so you could, and oftentimes it's associated with fear and concern of like, what's happening here? And so your body immediately attaches an emotional, you can say an emotional hook or tag to an area of your body. Then then that layer, we need to look at your emotions. Well, is fear involved with that? What concerns are involved with that? And that needs to be addressed and looked at. Then the third is the mental realm. So what beliefs or rules might you have around a particular area of your body? Old stories that we carry. Maybe your grandmother had really bad low back pain, or your parents were stricken with arthritis, or you had a relative that was in a wheelchair. And all of a sudden, as soon as you have pain there, the mind now goes to, oh my God, I don't want to be like them. I don't want to be like my parents. Oh my God, what if this doesn't go away and I'm going to be stricken in I'm going to be not being able to move, or I'm going to end up in a long-term care home. I mean, the mind creates and fabricates some pretty interesting stories when it comes to pain and when we experience pain. So understand that there's the physical cause, then there's the emotional response to it, and then third is there's the mental construct where we place stories and rules and beliefs and concerns around the pain. And so with any pain response, it can't just be one of those. It's intertwined and meshed with all three. So I want to ask you the question is, if you have discomfort, if you have pain, what's really happening? From the mental realm, what stories are you creating about that? From the emotional realm, what do you feel? Do you feel helpless? Do you feel powerless? Do you feel like it's never going to end? Do you feel fear? Do you feel worry around it? Because that's interlaced in that pain. And then physically check in. So am I strong as I want to be? Am I as flexible as I'd like to be? And so you can check in with all three of these realms. In an interesting research study, they showed that women that went into Emerge, their primary pain, they had low back pain, the primary thing that was going on in their life was they were having relationship issues. And women associate and identify with their relationships oftentimes. And men oftentimes associate, the more masculine energy associates with finances and work. And so they found when men went to emergency rooms, they found that they were more prone to having financial disruptions and also a dissatisfaction at work. So there are stories in the social medicines that do tell us that our stories and things that are going on in our life are directly related to the pain and pain levels that we experience. So I encourage you to go and explore your physical, emotional, and mental realms and see what's bothering you. What do you need to work on? Do you need to start working on the physical realm? Have you done that for a while and you need to start to look at some other areas that maybe help to improve and enhance your healing and health progress? So I encourage you to look at all three, and I'd love for you to continue the journey with us here at The Connected Life. Just click on the subscribe button below, and we'd love to see you on the inside. Take care.